Hello and welcome to episode number 132, where I speak with Dr. Marianne Teitelbaum about the critical role the gallbladder plays in the body and what happens to our health when we develop gallbladder sludge. Dr. Teitelbaum gives us lots of tips how to thin out the bile and improve our health and well-being. So please stay tuned. Hello and welcome to Elements of Ayurveda, Empowering Wisdom of Life. I'm your host, Colette, and in this podcast, I hope to empower you to take charge of your own health by sharing the holistic teachings of Ayurveda, the ancient healing tradition from India. We will also discuss topics like health and wellness, nutrition, yoga, fitness, meditation, breath work, and much more, as well as interviewing lots of inspiring people along the way. My humble wish is to help you to connect to your true nature, to Mother Nature, and to each other. If you like the content, be sure to subscribe to the show, and the new episodes will automatically download for you to enjoy. If you're new to Ayurveda, I recommend you listen to the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. I've also set up a Facebook group for us to connect and to support each other, and I'd love for you to join me over at Elements of Ayurveda podcast group. And now here's the show. Hello and welcome to Elements of Ayurveda. Today I'm very happy to welcome back Dr. Marianne Teitelbaum, who obtained her Ayurvedic practitioner certification in 1992. In the late 1990s, she began a 17-year one-to-one internship with Vidya Ramakant Mishra, an award-winning herbal formulator who hails from a 5,000-year-old family lineage of Raj Vidyas, treating the royalty of India. During her internship, Vidya Mishra taught her how to treat practically every disease, making over 500 herbal formulas for all the problems they were treating together. Dr. Teitelbaum is now writing books, articles, blogs, and courses based on the knowledge Vidya Mishra imparted to her before his untimely passing in April of 2017. Her first book, Healing the Thyroid with Ayurveda, Natural Treatments for Hashimoto's, Hypothyroidism and Hyperthyroidism, was published in March of 2019. And we spoke in detail about that book in the podcast episode number 81. Welcome back to the podcast, Dr. Teitelbaum, and thank you so much for being here today.
Oh, thanks for having me.
It's a pleasure. And as I mentioned a moment ago in our previous chat, in episode number 81, we were discussing your book, Healing the Thyroid with Ayurveda. And you mentioned in that chat that your favorite chapter was on the gallbladder. And this is what I really want to discuss in detail today. And not only the fact that it was your favorite chapter, but also that the gallbladder removal is one of the most common surgical procedures, which really tells us that there's a serious problem here. And I guess let's start with the critical role the gallbladder plays in the body, please, if you could explain that to us.
Well, the gallbladder is about the size of a pear. If you could visualize it, it's just a vessel that the liver drips bile into it all day, almost like a balloon, so that by the time you eat your meal, it's filled with bile. And as you're eating, it's squirting bile into the bile ducts, and so that you can digest the fats in the food. Whatever fat you're eating, they're large globules that can't be absorbed into the cells, whether it's butter, olive oil, milk. So the gallbladder's bile contains two detergents that emulsify the fats so that you could take them into the cells and utilize those fats correctly for all different things. So, for instance, the brain needs fat. The hormones that you make that keep you young and the adrenal hormones are made of fat, and fat's used widely throughout the body. So it's important that you're able to digest the fat. So it's the role of the gallbladder to do that. However, there's numerous reasons why the bile might not squirt with each meal. And we're actually talking about a quart of bile being squirted every day. So if the bile doesn't squirt, it accumulates in the gallbladder and it just sits there and it can become quite problematic.
Thank you for that explanation. And you mentioned in your book that the gallbladder can, if it's not squirting properly, it may be due to this gallbladder sludge. Can you tell us what is gallbladder sludge and what are some of the symptoms of this sludge?
Well, normally, again, when you're eating, the gallbladder squirts the bile. The bile is like a liquid. So if the bile stagnates and sits too long in the gallbladder, and throughout this podcast, we'll discuss different reasons why the bile might get thick and why it might not squirt. But if the bile isn't squirting, it starts to get thicker and thicker, and it doesn't squirt, and it turns into this thick sludge. And instead of being like the consistency of a liquid, it becomes thicker, almost like a toothpaste. And then if you don't know that you're developing bile sludge, you could sit there and start to develop gallstones, and then you have gallbladder disease. So the idea is to detect this early on and thin out the bile so you don't develop gallbladder disease. But if your bile's getting thicker, you might notice that you have pain under the ribs on the right as the gallbladder gets bigger and bigger. It's almost like a balloon that's being filled with too much water. And as it gets bigger and bigger, as the bile's not squirting out, because don't forget it's holding a quart of bile every day, it'll start to press on nerves under the ribs. And sometimes you could have pain radiating into the back, or you might have a feeling or a sensation that it hurts under the ribs on the right, or there's pressure there. You also might notice that you're belching and burping a lot, or you have indigestion, heartburn, gas, and you feel very uncomfortable after you're eating your food, even nausea. And if it gets too bad, you can have gallbladder attacks and vomiting and severe pain.
So is the goal of the gallbladder, obviously the goal is to emulsify the fats, to break down the fats, but is it necessary for the gallbladder to empty?
Oh, yes.
Bile? Like, is that daily or with every meal?
Every day. Every day. Whenever you hear squirting, we've all heard squirting in our abdomen. Lots of times that squirting that you're hearing and feeling is the gallbladder releasing bile. So yeah, it needs to squirt every day because again, you're squirting throughout the course of the whole day about a quart of bile. So it can't remain in there. And if it does, then you start to have these gallbladder problems.
Right. Then the sludge forms and it's becoming more static.
Yes.
Okay. And so what happens then when the gallbladder isn't working properly? What effect does this have on the body?
Well, several things. So, and this is why I love the chapter the most, because all the things that it creates, we're treating incorrectly. So let's take one problem at a time, and we can talk about that thoroughly.
Wonderful.
So when you first swallow food, it goes into the stomach. And there's all this acid in there, churning the food into a liquid acid. We all know when we vomit, it's like you could taste those acids and it's very hot. So that's the role of the stomach, to turn your food into a liquid acid. From there, it squirts into the duodenum. And the duodenum is the beginning of the long journey that the food will now make through the small intestines, the large intestines, and then it comes out at the other end. But the duodenum is like a transition area where the food coming in from the stomach is acid, but it has to leave alkaline. So the way that happens is that as soon as the food enters the duodenum, a signal is sent to the gallbladder to release the bile. So that's another function of the bile. It's alkalinizing the digestive juices so that as they go through the rest of the digestive tract, they don't burn the lining of the gut. And also, the bile creates what we call peristalsis, little muscular contractions to move the food downward through the gut. So if the bile isn't flowing, the food stays acid and it can reflux up. So we could call it acid reflux. And the mistake modern medicine makes when they see that is they give medicines called proton pump inhibitors. These are acid reflux medications to decrease the amount of acid in the stomach. So now you have no stomach acid and the bile's not flowing, so you're in a worse state. It's true those acid medications could take away the acid and the pain, but they're not getting to the underlying problem, which is the lack of bile flow, see? So that's a big mistake. The other thing, the side effect of taking those proton pump inhibitors or acid reflux medications is that you could develop what's called small intestinal bacterial overgrowth, which is becoming more and more prevalent in our society as people take these acid reflux medications. And the reason that can happen is that the food from the outside world has bacteria in it. So when it goes into the stomach, it's the role of the stomach to not only begin the process of digestion, but to kill the infection in the food. That's why there's all that acid in there. So many people taking these acid reflux medications, they're decreasing the amount of acid in the stomach, and then infection starts to grow in the small intestine, see? And so that's a side effect. There's many side effects from taking these acid reflux medications, but that's one of them.
Right, and people might know that by its short name, SIBO.
Yes, they call it SIBO.
Right.
It used to be very uncommon, and now it's getting very prevalent.
Yeah, you hear of it a lot.
Mm-hmm. So that's just really one problem that can happen. You can develop acid reflux. In all the cases of acid reflux I've seen over my 35 years in practice, I've always seen that it's the gallbladder that's problematic. It's not that the stomach's making too much acid. So it's a big mistake that's being made. Other problem that can happen is you can become constipated because, again, the bile moves the food through the gut. So they call it different names like gastroparesis, where the food's just sitting in the gut. Or lots of people will treat the constipation. For instance, modern medicine might give a laxative like Miralax, or holistic doctors might give magnesium. These are different types of laxatives. But again, they're not getting to the root of the problem to increase the bile flow. If you look at any herb book and you kind of skim through it, whether it's Western or Eastern or Ayurvedic, you'll see many herbs promote the flow of bile. You've probably seen that, and you always wonder, why is that so important? Why did nature give us so many herbs to promote bile flow? And it's because it is a very big issue and a very big problem. So the herbs are sitting there waiting for us to use them.
Right.
But so that's why I wanted to write the chapter, to let people know that, this, you can do things about the gallbladder. You don't just sit and let it become so congested where you develop gallbladder disease.
Right. And the constipation is a result of the lack of peristalsis.
That's right. It's from lack of bile flow. Mm-hmm.
Right. So the bile promotes the peristalsis, the movement along the intestines.
Yep, that's right. And that's only the beginning. The other thing that can happen, which is also very prevalent, is that the liver breaks down the estrogen that you use every day at the end of the day, and it dumps it into the bile. And the reason nature was so wise to do that is because estrogen makes things grow. It made your hips grow at puberty, your breasts grow, and it builds up the endometrium lining, the lining of the uterus, which you shed every month if you're not pregnant. So we want some buildup, some growth, but we don't want too much. So our body is capable of getting rid of that estrogen. So if the bile's not flowing, the estrogen that the liver dumped in there sits there and it reabsorbs back. And you wind up with a situation that is extremely common, where there's high estrogen, low progesterone. So with many of these people, they'll start to form either uterine polyps, all different types of growths, cysts on the ovaries, cysts on the breast, fibrocystic breast, thyroid nodules, or even uterine fibroids. So the doctors might treat those. They might remove the fibroid or the polyp, but nothing's ever done to recalibrate that ratio between estrogen and progesterone. And in that chapter, I give the tea that we use that does that, herbs that can do that, but you have to back up. And you have to also treat the bile, make sure the bile flows.
High estrogen, it's so common. So it's getting reabsorbed because it's not been broken down at the end of each day.
That's right. It just sits there. Just like the liver takes fat-soluble toxins. Keep in mind, all the fats that you eat, they're going into the bile. The estrogen is made of cholesterol. It's going into the bile. And in the book, I wrote that there's two types of toxins. One are water-soluble, the other are fat-soluble. The water-soluble ones come out of the body very quickly, but the fat-soluble ones have to go through this whole process where the liver has to process them and, again, dump them in the bile, and then the bile squirts it into the intestines, and they come out every day. The fat-soluble toxins are the very dangerous ones that cause lots of cancer, like pesticides and, different environmental chemicals that we're breathing in every day and are exposed to in all different ways. So it's important that they come out of the body every day. But again, if the bile's not flowing, those toxins also reabsorb. So many people I see say, oh, I want to do a detox, but I make sure they don't do any detox until the bile's flowing well. Otherwise, you're going to pull toxins, dump them in the bile, they reabsorb. Pull toxins,
Right.
yes, and you won't get anywhere.
Yeah, so the water-soluble toxins are released in our sweat and in our urine and feces,
Yeah.
right?
Yeah. Mm-hmm.
And is it true that then if the liver is overwhelmed, which it is in our society today with given the environmental toxins and all other toxins we take in, the liver is under a lot of pressure, are these fat-soluble toxins then sometimes stored in the fat cells?
Yes. Yeah, that can happen. And also, if if the gallbladder's not working, and you're not digesting the fats in your meals, those fats sit in the gut. They go rancid, and they're dumped in the fat cells also, and they make cellulite. So our fat tissue is harboring lots of toxins for all different reasons. So that's why I felt that it was very important to discuss the role of the gallbladder, which I haven't seen discussed in too many books on Ayurveda or other health books.
Yeah, it's so important. And like I said earlier, it's because it's treated almost like the appendix. When the appendix is inflamed, it's like, oh, take it out. We don't need that anymore. And it's really almost seen like that as well, that the gallbladder is like, oh, we can just get rid of that.
Right. And the other sad part to this is that I'd say over, my 35 years of practice, many of the patients, at least 3/4 of them at some point will develop gallbladder sludge. And it's very easy to reverse. And in just about all of those cases, we were able to reverse it. So they didn't continue on and develop gallstones and gallbladder disease. So when I hear people are having their gallbladders removed, I always feel bad that they didn't know that they could have done something earlier on. But modern medicine is not real keen on detecting imbalances. They can't detect these early stages so well, and sometimes they let it go too long. But nowadays they have a new test where they can detect sludge. And when they see that, they remove the gallbladder, and that they shouldn't be doing because it's very easy to thin out gallbladder sludge and turn it back into a liquid.
Wow. Okay. Well, we definitely want to get to that. I want to talk about that easy reversal process. But before we get there, was there anything else you had to finish up before we leave? That we talked about acid reflux and constipation and the estrogen.
Yes. Many people say, if you look at the inside of a cancer cell, or if with any cancer or autoimmune diseases, what you'll see is the inside of the cell has inflammation. So everyone talks about this inflammation, this acid in the cell, but they don't really talk too much about where it might be coming from. It can come from many sources, like if the liver's overwhelmed with toxins, and the toxins are continuing on in the blood. Many toxins are acidic. But we also have to consider the fact that the gallbladder alkalinizes the whole body. So when you first swallow the food, once you digest it properly, from the digestive tract, it becomes the blood. So it's very important early on that these acids coming from the stomach are alkalinized, because alkaline digestive juices will become alkaline blood in the next step. So many people are acidic because their bile's not flowing. And then many things can happen, like, you don't want the inside of your cells acid. Also, the body's very keen on detecting when the blood is alkaline or acidic. And if it's too acidic, the bones will give up their calcium to keep the blood alkaline. So it can also be a contributing factor to osteoporosis and osteopenia. So you can see that it's so important that our bodies be alkaline, and it all starts with these early stages of digestion. And that's why both Hippocrates and the ancient doctors of India said that many, if not most or all health problems could be traced back to problems with digestion.
Right, exactly. And I also wanted to cover the correlation between the thyroid and the gallbladder, which is this book you wrote was all about healing the thyroid with Ayurveda, and you had this chapter on the gallbladder. So what is the correlation there?
Well, early on in my practice, over the last 35 years, whenever I detected thyroid in a patient's pulse, I also at the same time always saw gallbladder. And I saw it so much, I thought there must be a relationship that when the thyroid doesn't work, the gallbladder doesn't empty the bile. So I checked the research, and sure enough, there it was. It's called the sphincter of Oddi. It's the sphincter in the gallbladder that releases the bile, it actually won't work when the thyroid's weak. And I looked to see if any Eastern medicine had found this out, and the Chinese said that the acupuncture meridian, the thyroid and the gallbladder feed into each other. So if the thyroid is weak, automatically there'll be less energy for the gallbladder to work. So there is this connection that we're seeing in both Western research, and also the ancient Chinese doctors saw this correlation as well. So when you fix, you'll notice many people who have thyroid problems in the next breath will tell you they also have fibroid tumors, cysts on the breast, thyroid nodules, acid reflux, constipation coming from the gallbladder connection.
And so what happens when the gallbladder is removed? If, a person goes the Western medicine route and they notice that there's sludge and they're like, let's just remove the gallbladder. What happens in that case then? Because that system now is changed.
Well, the gallbladder is just storing the bile. So they just create a shunt from the liver directly into the duodenum. So the bile's still going in there. But what I see with our patients is that even though they remove the gallbladder, the bile's still thick. And those patients still need to do the work to thin the bile back out again.
And so let's talk about that reversal then of the gallbladder sludge. How do we go about that process?
That's why I had to write a whole chapter. There's many things you could do. If you can visualize it, all the fats are going into the bile to be processed. All the fat-soluble hormones like estrogen, the fat-soluble toxins. So there's a lot of fat going into this little pear-shaped vessel. That's all it is. It's just a vessel holding the bile. Mm-hmm. So if you think about it, think of chicken soup, what happens when you put it in the refrigerator. The fats congeal. So think what would happen to the bile, which is holding all the fats to be processed, cholesterol and all that. Well, what will happen if you're drinking ice cold beverages, ice cold water, iced tea, ice cold coffee? You're going to make that thicker. See, it's going to create bile sludge, even without a thyroid problem. Mm. But if you do have a thyroid problem, it's going to create sludge, even if you're not doing that. But any ice cold beverages, also foods that are very, I call them gunky, thick and sticky, like cream cheese or hard aged cheeses like cheddar cheese, or grilled cheese sandwiches, or any kind of cold dairy like ice cream and frozen yogurt. That's going to thicken the bile. Or nut butters like peanut butter, almond butter. That's going to thicken the bile. And the red meats like that. So in the book, I list the different foods that would make the bile thicker. And then once you realize you have this sludge, what you can do to thin it back out. So there's a lot of things that you can do. So it's not too late if you have bile sludge.
Okay. And, often I hear people saying that when they eat these fatty foods, they feel nauseous. You mentioned nausea earlier. And so that is almost like the very fatty, heavy foods that you were talking about there, that they're creating this nauseous feeling because there's so much of a buildup of fat.
Yes. For instance, in Ayurveda, they recommend that you take whole milk because the fat in the milk delivers the calcium in your bones. So you don't want to be drinking skim milk. But they also say you have to boil the milk to thin out the fat so it can be absorbed. And so it doesn't thicken your bile. But many people in the Western world don't know to boil the milk. They drink it cold. And then they have gas and bloating, and they say they feel nauseous because that's a good example of taking food in an incorrect way that will create problems with your digestion, especially the gallbladder.
Yeah. And of course, in the West, and particularly in the US, when you're going out dining, you get your ice drinks. There's ice everywhere. It's just,
everywhere.
Right? So
what I do when I go out to eat, I ask them to bring me a little pot of hot water, and they do, with a little squirt of lemon in it. Right. Yeah, that's better to do. And you'll feel like you're digesting better if you're sipping the hot water with your meal as opposed to that ice water, which is automatically going to put your digestive fire out.
Yeah. Yeah. So then your food is sitting there while your body has to heat up, then it has to cook it, digest it, and so on. So that's causes a lot of ama. And there's so much fat now in our processed foods as well.
And it's the type of fat that's very dangerous. Yeah. everywhere you go, they're using vegetable oils, blends of vegetable oils, because they're very cheap for the restaurants. I don't think many restaurants could stay afloat if they used olive oil and ghee, which are much lighter and easier to digest because they're so expensive. But when we cook with those fats and we heat them, they form a plastic that will not only clog our gallbladder, but clogs our arteries. That's another whole podcast we could have where everyone's thinking cholesterol is clogging us. It depends on the nature of the cholesterol. It is true if it's coming from red meats and hard cheeses, because they just clog all the physical channels, including the arteries. But it's not true if the fats come from something like ghee. In fact, ghee, the clarified butter, that's why the ancient doctors said to cook it. You notice you're taking butter that was cooked, and by taking it through the clarification process, you're skimming off the dairy solids, turning the butter into like an oil of the butter, which absorbs easily into the cells and won't clog the arteries. And in fact, there's something in ghee that prevents any plaque from building up in the walls of the arteries. So that's like another whole realm. But eating ghee would be very good for the gallbladder.
Yeah, I get asked that question all the time about ghee and its relationship with cholesterol. So I'm glad you explained that. And I think we could definitely do a whole podcast on cholesterol because that's a huge issue for people as well. So ghee is great for the gallbladder, and some other foods like, I know beets are good, apples.
Of all the foods to promote the flow of bile, beets are the absolute best. When you eat cooked beets, though, and don't open up a can and eat the beets, like actually cook the beet yourself. But they are very good at promoting bile flow. Artichokes are good as well. It's just hard to get them in season all year round, whereas beets are pretty easy to get. Apples are good too, but nothing's as good as the beets. I have some patients whose bile is just so thick that nothing helps them. Even the herbs and the beets help them. So it's just as effective as the herbs that we use.
Wonderful. And so how do you tell, besides from the symptoms the person is having, how can you tell if the sludge is thinning out?
Yeah, a lot of it goes by the symptoms. I can tell when I feel their pulse.
Right.
Also, you feel all this ama.
Right.
In my book, I talk about exactly what it is we feel in the pulse, that we call them the doshas, the subdoshas. And so you can feel that in the pulse of the gallbladder, and you could feel all that sludge kind of thinning out. And usually the patients will tell you they feel better.
Okay. So how do we ensure, besides from those foods we mentioned, how do we ensure that our gallbladder is functioning correctly? Maybe what are some self-care practices we could do?
Well, in the book, I wrote how to remove the sludge yourself. There's herbs that I mentioned, foods. You could sip hot water to keep the bile nice and thinned out. But you can actually work the gallbladder meridian, the acupuncture meridian, kind of like using acupressure. And you can just working part of the meridian from the hip to the knee. You start up at the hip and you press where the seam is in your pants and the lateral part of your thigh, just on the outside, and press, and you work your way towards the knee. And you'll do it on both sides, and you'll notice that one side really hurts, especially in the middle of the thigh. That's the actual point on the gallbladder meridian that's clogged up. So you're not getting the full supply of energy. The Chinese call it qi. We call it prana in Ayurveda. Every organ and gland needs a full supply of this life energy to it. So if that meridian is clogging up, then the gallbladder can't work. So you keep pressing that point until the pain goes away. But as you're pressing downwards to the knee, come back up to the hip, press downwards, come back up, you'll start to hear the gallbladder squirting the bile. It's actually a very easy thing to do. I taught my children how to do this when they were young, and I've taught all the patients how to do it. The other thing you can do is lie on your left side and tap under the ribs on the right. That's where the gallbladder is. And if you just keep tapping it, almost like you're tapping a baby when you're trying to burp them, just very gently. But if you keep doing it for 5, 10, 15 minutes, you'll hear the bile squirt out. Sometimes it becomes very rhythmic, like you'll squirt a lot and it'll stop. And then it'll squirt a lot and stop, depending on how much bile is stuck in there. And I've had patients where after a half hour, all the bile came out. They were really storing a lot. And they felt so much better once all the bile came out, because it can actually really get stuck in there and create lots of problems.
Yeah. And so, like you said, it's a balloon on the right side, underneath the right rib cage. Is that correct? And then that people may actually feel it. Like if you press on that area, and if that sludge was very hard and dense, could you feel it?
Oh, yes, you can feel it. Once you get used to seeing what it feels like when your gallbladder is empty of bile, it feels very light in there and almost blissful after you eat. And when it's full with bile, you feel kind of nauseous and heavy, and there's pressure there. You can easily learn how to get that bile out. I've trained all of our patients very well. And the bile getting thick is something that happens numerous times, probably dozens and dozens and dozens of times in a lifetime. So that's why it's imperative to know how to keep this bile flowing, so you don't wind up as a statistic getting your gallbladder removed.
Yeah, exactly. And is there a seasonal effect on the gallbladder sludge?
Yes. In fact, I always call the spring and the fall gallbladder season, because when the temperatures fluctuate, like right today, it's in the 50s where I am here in the States, and it's chilly and raining. Now it's going to be 70 in a couple more days. And that fluctuation of temperatures upsets our digestion. The ancient doctors called it the Agni, the digestive fire. One thing I like to do is try to interpret for Westerners what they were saying, so we can say that the gallbladder will get very upset when there's those changes, see?
Yeah, absolutely. And hence they focus on seasonal cleansing at that time.
Yeah. Yes.
Right. So important. I just want to confirm again the placement of the meridian. So it's running from the hip to the knee, and it's almost along the IT band. Is that correct?
Yes. In fact, many people will tell me, I've been seeing a physical therapist, I have a problem with my IT band, and here it's the gallbladder meridian. It gets very painful when it backs up. And many people I've talked to who know acupuncture and they know shiatsu and they're familiar with working with the meridians say, yes, they think it's the IT band, but it's really the gallbladder meridian, because it's so common in people.
Yeah. And, I do foam rolling after I exercise, and that IT band. And I know that midpoint where sometimes I really feel it. It's so sensitive. Like you talked about the midpoint between the hip and the knee. So I think even doing something like foam rolling, or even if you're sitting in a chair doing work or watching TV, you could easily run your hands up and down your thighs like that.
Yep, easily. Yep. If you look at the acupuncture meridian charts, you'll see a big circle in the mid-thigh. That's the area that always gets clogged up. And the Chinese knew that was the main area to press on. And then the bile would start to flow. The meridian also runs down the back of the neck. So sometimes you can just rub the back of your neck. One of my patients had a gallbladder attack when she was in China. And in China, the doctors come to your house and work on you. And this Chinese doctor worked on her neck and the gallbladder meridian for a half hour until the gallbladder pain went away. See how they know there, whereas here we're not familiar with that.
Interesting. So that meridian runs from the outer thigh to the neck?
Well, it actually zigzags through the head. If you look on a meridian chart, you'll see all the meridians, how they run, and it zigzags back and forth. In fact, many of our gallbladder patients get dizziness when the gallbladder's not working, because the energy's backing up back and forth in their head. I've seen that so many hundreds of times. They're thinking they have this thing called vertigo, when really the gallbladder's backing up and creating all that dizziness.
Oh my goodness, that's amazing. And is there neck issues as well?
Yeah, either could create either. In other words, if your neck is stiff, then it's going to impede the flow of the chi or the prana through the gallbladder meridian. So you want to keep your neck nice and loosened up. Yeah.
And so if somebody knows that they have gallbladder issues, they're listening to this and they're going, oh my goodness, that my gallbladder is in trouble. What extra steps should they take if they know their gallbladder is not working correctly?
Well, I would read that chapter, and I would not only treat the gallbladder, and there's so many things in there, the herbs we use, there's teas, sipping hot water, running the meridian, like we were saying, avoiding the foods which create the sludge, the ice cold beverages, but also to look beyond that and see if you have subclinical, we call it, thyroid. Many of the thyroid cases I see, they have a thyroid issue, but it won't show up on blood work. So one way you would know is if your hair is falling, or you're gaining weight for no reason, you're very tired or depressed, you're having heavy menstrual flows or having growths. So these are telltale signals that your thyroid might be a little weak. And again, many times you'll go to a doctor and they'll say that it's normal, but if it's weak, it might not always show up on blood work. But you want to also address the thyroid as well.
Very interesting, Dr. Teitelbaum. It's just fascinating, this little pear-shaped sac and the bile, and it can have such an effect on our body. It's just shows that we can't have this reductionist medicine. We really need to look at the body and the mind in its entirety, and one thing affects the other. And in saying that, does our mental health affect the gallbladder and the bile?
Yes, because the whole digestive tract is very linked up to, our psyche. Mm-hmm. But like we hear some bad news, we get diarrhea right away. So if someone's very nervous, the sphincters might not open. So if you're aware that you're that type, a nervous type, we call it too much vata in Ayurveda. In my book, I have all these different explanations of what vata is and what to do about it. There's ways you can relax your body, but if you know that you hold your abdomen tight while you're eating, you have to work on keeping it nice and soft and calm so that all these various sphincters can release their fluids. The stomach has to release the pyloric sphincter, and the pancreas squirts through its sphincter. The gallbladder has to squirt. So if you're very tight and anxious and worried and nervous, those sphincters will get too tight.
Right. It's like that vata constriction.
Yeah.
Right.
My teacher, he was a very great Ayurvedic doctor, and his father was even just as famous in India, had a huge practice. So he was busy all day, but he always took a 2-hour lunch break. And after he ate lunch, he would lie on his back for 5 minutes, then his left side for 5 minutes, then his right side for 5 minutes. And you're just relaxing the whole digestive tract, because when you're lying on your left side, it helps the gallbladder to release through that sphincter. And when you're lying on the right side, it helps the pancreas and stomach to release through those sphincters. So see here, we eat in a rushed manner. We have a quick lunch break and we jump right up.
Right.
So that too can also create lots of problems with the digestive system.
Yeah. And is there one dosha that's more susceptible to gallbladder sludge?
Vata is considered the leading dosha. So many people I see, they're Vata types. They're hyper, they're thin, their hair's thin, they're very anxious and worried. They always have gallbladder problems because they're not allowing digestion to occur enough. And I'll talk about that in the book. But then when Vata goes out of balance, then see if the bile doesn't flow, you get too acidic. Mm-hmm. So we call that Pitta in Ayurveda. And the ancient doctors said that Vata was the leading dosha, that when Vata went out of balance, it would push on to Pitta, that would go out of balance, and then eventually kapha. So what we see is that people are rushing, worried. No matter if they're a Vata, Pitta, or kapha type, you can still throw Vata out of balance. And then you get too acidic, and then the sludge forms, and you get, you become overweight, and you don't digest the food well. But I think any of the three, Vata, Pitta, or kapha, could develop problems with the gallbladder.
Okay. Such great information. I'm glad that we've taken the time to highlight this little gallbladder sac, which has such a critical role. Is there anything else that we didn't cover that you want to share with us?
Yes, I almost forgot one of the very most important things. When the bile doesn't flow, the bile clears the cholesterol out of your blood. So your cholesterol will go up. So in the Western world, they give medications, they're called statin drugs, to lower the cholesterol, which they have severe side effects. They can create dementia because the brain needs cholesterol, so they're lowering it. And you could get neuropathy as the nerve tissue dies from lack of fats. So then when you see a more holistically oriented physician, they might say, well, we can lower the cholesterol with red yeast rice, niacin, and fish oil. But when the patients come to me, I tell them, we want to fix the reason why the cholesterol is high. We don't want to just have that idea that we want to lower cholesterol. So we look and we see it's usually a problem with the liver and or the gallbladder. They're both involved in pulling and clearing the cholesterol out of the blood. So if your bile's not flowing, and your cholesterol is definitely going to go high.
Okay. And you did mention in the book about taking fish oils or taking supplements like that. Can you speak a little bit about that and the problem with that?
Well, just think about that. Your bile is always processing the fats you eat every day. If you swallow pearls of oil like fish oil, vitamin E, vitamin D is a fat-soluble vitamin, all these oils, you're dumping a lot of fat all at once into the gallbladder, and you're running the risk of turning that nice thinned out bile into a sludge. So when I would sit with my teacher as he was training me in Ayurveda, and he was a very advanced pulse diagnostician, people would ask him, should I take fish oil? And his reply was always, eat the fish. Just like I'll tell people about the benefits of ghee, and they'll say, oh, should I take a teaspoon or a tablespoon of ghee at night? And so you don't want to do that. Like olive oil is also good for you, but you don't want to be swallowing tablespoonfuls of olive oil, but instead cook with it. That's the idea.
Great advice. Dr. Teitelbaum, such wonderful information. Thank you so much. I think it's really important to highlight this, and I think we've covered a lot, and I really appreciate you taking the time to talk about this today. Can you tell the listeners where they can find out more about you and your offerings? Are you offering online consultations right now?
Yes, I always have, but especially now with the coronavirus, I have just limited my practice temporarily to phone consultations and Skype sessions. So I'm seeing all my patients that way. We're not allowing them at this time, and they don't want to anyway. We have lots of coronavirus here in New Jersey at this point in time. So yes, people can just reach me through my website, Dr. Marianne Teitelbaum, if you see that. And on my website, I have classes that anyone could take. They're free. I offer them to everyone. They're 1-hour lectures. If you look, it says online classes. You just click on that link and these 10 classes will pop up and you can listen to those. They're audio lectures. Yeah, that way you can educate yourself. But you can reach us through telephone, and we do, again, Skype sessions all around the world.
I appreciate you sharing this wonderful wisdom. I highly recommend that people check out your book, Healing the Thyroid or Ayurveda, Natural Treatments for Hashimoto's, Hypothyroidism and Hyperthyroidism. I found it fascinating, and it's a book I always go back to as well. And I really appreciate you sharing this knowledge with us and highlighting these issues that are not often talked about.
Thanks for having me.
I hope you enjoyed that fascinating conversation with Dr. Teitelbaum. If you think any of your friends or family will be interested in this conversation, please share the episode with them. I think it has a lot of very important information for people out there. And please check out the show notes for Dr. Teitelbaum's website links and to the book. If you want to check out my online consultations and online programs and cleanses, please click on the link in the show notes or visit my website, elementshealingandwellbeing.com. If you have any questions, take advantage of the free 15-minute online service inquiry call. And if you haven't already done so, please subscribe to the podcast and also maybe rate or review it wherever you listen to your podcast. I would truly appreciate that. Until next time, take good care of yourself, be well, and ciao for now.